The first question I want to ask is kind of a follow-up to the last session where we had the nursing unions here to talk about the problems that essential healthcare workers had. The department in their submission say to us that the scheme of childcare for essential healthcare workers had to be cancelled because it was not possible to meet all the requirements that would have made it attractive to providers. And you just mentioned the element of insurance there. Could you elaborate, but kind of briefly, because we're stuck for time, on what were those elements that were an obstacle to the scheme that was introduced? Were they just insurance? Was there premises costs like paying on rent and rates and stuff? Was it a lack of sick pay? Could you just elaborate very briefly, maybe one of you, on those barriers that stopped that scheme working?
Okay, I'll take that question, Mary Daly from Cron. First of all, I'd like to say that it wasn't in any way connected, from our point of view, to not been worthwhile for us to reopen. We would have very welcomely reopened our services using family pods if we were allowed to do it from our services. But insurance-wise, that for some reason wasn't possible. Going into somebody's home, again, insurance, you're then looking at employer's law, you're looking at supervision, you know, the service taking our responsibility and having to supervise the people in there. You were leaving our staff wide open to allegations that may be made against them. So there was numerous reasons why it didn't work. And really, I can say from my part, it had nothing got to do with it being worthwhile for the provider.
Thanks very much. I think that answers it for me, because I didn't believe for 1 minute that you didn't think it was valuable or worthwhile doing. There was obviously obstacles, and very complex obstacles there for you. But I've heard a few of you mention a couple of times the fractured nature of the services and how there's so many different organisations overseeing different aspects of it. And believe me, I'm not your enemy. I think you're all wonderful, and I know lots of childcare providers and workers in my own community. But it strikes me, and this is a point you may not like me saying, that one of the problems we have is that in this country we have the highest level of childcare provision in the whole of the OECD. The levels are huge compared to other countries. The data shows that 99% of children attending pre-primary education were enrolled into private institutes. The OECD average is 34%. And so I do think when other deputies talk about the need for a conversation and probably an assembly to look at this, that we really do have to cop on in this country and look at the public provision of childcare, the way we look at the public provision of education and health. And that should not exclude you, the very dedicated workers who are highly trained that work with you. Instead, I believe it should encompass you, and we need to start looking to that public model, because if you take the data that shows the benefits of a publicly funded model in the Nordic countries, which are always the best, and I've seen this firsthand where my two nephews grew up in Sweden, they spend 1% of GDP on childcare, and we spend about 0.4% on childcare. And so with high levels of public investment, you get better returns for these children. And that high level of public investment also yields better security, better returns for the parents, a higher level of maternity or maternal workplace engagement, and it probably would have helped going a long way to solve the problems that we had with our frontline workers. The fees are lower for parents, all of the rest of it. The outcomes are much, much better. So in the brief minute we have left, understanding that I'm not opposed to you people, that I'm on your side, would you comment on the question of the need to move to public provision and a higher spend of GDP on childcare, please?
Thanks, Deputy Smith. Just coming in on that, we're not disputing that we need to look at a different model, or that we kind of need to kind of consider how we are going to be going forward. But I suppose the reality is that childcare has grown up in Ireland the way it has because of the lack of kind of government interest or government investment, or it hasn't been seen as a priority. So in the absence of that, I mean, it was something that women in the local community set up for each other and kind of supported each other, which gradually extended to families and then gradually extended to kind of centre based. And And that has been the reality for 40, 50 years. So we are looking in terms of a new model now, and it's a new model that would incorporate the brilliant work that has been done by providers for many different years in the absence of that level of investment. There's no way, I suppose, when we're looking at the fees in Ireland, we're looking at big fees because of the lack of government investment. It's not that the provision in Ireland is so hugely much more expensive than what it is in other countries. It's that the fees for parents are not subsidised in relation to that. So certainly when we're looking at a funding model and we're looking at it being more public provision, that is something that everybody would welcome in terms of those discussions, to see exactly how that would work best for families and for the children, for our society.
Thank you, Ms. Quinn. Okay.